WaterAid ဆိုတာကရေအရင်းမြစ်တွေမိန်းလာစနစ်နဲ့တကိုယ်ရည်တန်ရှင်းမှုပိုင်းဆိုင်ရာလုပ်ငန်းတွေကိုအဓိကဆောင်ရွက်နေတဲ့ကမ္ဘာလုံးဆိုင်ရာအဖွဲ့အစည်းတစ်ခုပဲဖြစ်ပါတယ်။အခုမြန်မာနိုင်ငံမှာလည်း WaterAid မြန်မာကတော့ဒါအစိုးရနဲ့လူမှုအဖွဲ့အစည်းတွေပုဂ္ဂလိကအဖွဲ့အစည်းတွေနဲ့ပူးပေါင်းပြီးတော့လက်တွဲလှုပ်ဆောင်လာတာဒါ3နှစ်တာကာလကိုရောက်ရှိနေပြီဖြစ်ပါတယ်။အဲ့တော့ WaterAid မြန်မာအဖွဲ့အစည်းအနေနဲ့အခုလက်ရှိမြန်မာနိုင်ငံကိုဘာတွေကိုညီဆောင်ရွက်ပေးနေတယ်လဲ။နောက်သူတို့ရဲ့ရှေ့ဆက်အနာဂတ်မှာရောဘာတွေဆက်လုပ်ဖို့ရှိမလဲဆိုတဲ့အကြောင်းအရာနဲ့ပတ်သက်ပြီးတော့ WaterAid မြန်မာရဲ့ Country Director ဖြစ်တဲ့ Mr.Shihab နဲ့အခုပဲတွေ့ဆုံမေးမြန်းသွားမှာဖြစ်ပါတယ်။ Mr.Shihab မင်္ဂလာပါရှင်
။မင်္ဂလာပါ
။ဟုတ်အရင်ဆုံးဒီ WaterAid မြန်မာအဖွဲ့အစည်းကြောင်းလေးအရင်ရှင်းပြပေးပါလားရှင်။
WaterAid is an international organization. We are working almost in 38 countries across the world, in Asia, Africa, Latin America, Europe, and different countries. In Myanmar, we are working since 2016. Our major work here is working with the government and also the communities and civil society.
ဒီ WaterAid မြန်မာအဖွဲ့အစည်းอ่ะဗောနော်မြန်မာနိုင်ငံမှာဆိုရင်လည်းဒါကူညီဆောင်ရွက်မှုမျိုးတွေလုပ်နေတာတွေသိရတယ်ဗောဘယ်လိုကူညီဆောင်ရွက်မှုမျိုးတွေလုပ်ပေးနေတာလဲပြီးတော့ဒီပြည်နယ်နဲ့တိုင်းဒေသကြီးတွေမှာဘယ်ပြည်နယ်နဲ့တိုင်းဒေသကြီးတွေကဒီရေနဲ့ပတ်သက်တဲ့ဗောနော်လိုအပ်ချက်တွေရှိနေတယ်လဲရှင်
WaterAid program in Myanmar, as I said, is we started 2016, and since then we are working mainly with the government, reaching out most of the needy places, and you want to know that where is the most need in terms of water and sanitation. If you look at the data available, basically the UNDP data and also the UNICEF data that we use. According to that report, Rakhine State, they have the highest need in terms of water and sanitation. And the second is Kaya and Kayin. Also, Magoe and Irrawaddy region also they need water and sanitation more than other areas. But also there are many different kind of need. Some area they have a water. Clean or saved or like a available sweet water, but it's difficult to get like in mountain area. Water is available somewhere, but you have to walk. Some area in Irrawaddy, you have a lot of water, but it's not potable because it's like a lot of it's like a saline water. So the different area they have a different kind of need in terms of the water and sanitation, but mostly it is in Rakhine, Kayin and Kaya, Magoe and Irrawaddy.
ဒီ WaterAid မြန်မာအဖွဲ့အစည်းကြောင်းကိုလေ့လာကြည့်မိတဲ့အခါမှာ WASH Watch ဆိုတဲ့ဟာမျိုးကိုဆရာတို့အသားပေးပြီးလုပ်နေတယ်ဆိုတော့ဒီစကားလုံးလေးကိုရှင်းပြပေးပါလားဆရာ
It's an acronym. The elaboration is water, sanitation and hygiene. So this this is the term that we use in UN and also the international organization as a local organization and government also. So it's access to water. When you talk about the access to water, the target is access to clean water and safe water. It is safely managed. And also when you talk about sanitation, it also again we call the safely managed sanitation. That is the target. And when we talk about safely managed sanitation means that it's a toilet that people use which is clean and fly proof, and the exterior it also safely managed, like it go to the properly managed septic tank or emptying it and dump in a proper place or treating it further. So that is all safely managed. Also when you talk about hygiene is ensuring the hand washing station in every house with the running water and soap. And people also, it's not that only we have a hand washing station and soap and water, people have also attitude and their what you call practice to ensure that they use the water and soap and regularly wash hand. So that is the main area of water sanitation and hygiene practices, which is in short we call WASH.
ဒီ watch ဆိုတဲ့စကားလုံးကလည်းဒါဆရာတို့လုပ်နေတာက goal တစ်ခုလို့အနေနဲ့လုပ်နေရဆိုတော့အခုလက်ရှိမြန်မာနိုင်ငံမှာဆိုရင်ဒီ watch နဲ့ပတ်သက်ပြီးတော့ဘယ်လောက်ထိအနေအထားတွေရောက်နေပြီလဲရှင်
In terms of the SDG 6 goal, Myanmar is trying hard. If you look at the data from 2014 census and also look at the UNDP report 2017. So in this, if you look at the trend, it's improving a lot. I'll show you the data. And also the Myanmar government, they developed the strategy called National Strategy for Water, Sanitation and Hygiene. It's for the rural context, and including the investment plan. So the government developed the strategy and investment plan, and they're working hard on that. And international organization, UN organization, and also the local communities, they are also cooperating and trying hard to reach SDG 6 goal. But at the same time, what I want to say is that we have only 10 years to reach the SDG 6, 2030. So we have to achieve these targets. And 10 years, probably the current trend, if we go with the current trend, it will be difficult to actually achieve SDG 6 by 2030. So that's why we all need to work hard and speed up that our work, this water, sanitation, hygiene areas, so that we will be able to achieve that target by 2030.
ဒီမြန်မာနိုင်ငံမှာဆိုရင်ပေါ့နော်ဒီဆရာပြောခဲ့တဲ့အထက်မှာဒီ water ရယ် sanitation ရယ် hygiene နဲ့ပတ်သက်ပြီးတော့ဒီမြန်မာပြည်သူတွေမှာရှိနေတဲ့အလေးအထကိုဘယ်လိုများဆရာမြင်မိလဲရှင်ဘယ်လိုသုံးသပ်မိမလဲရှင်
Generally, Myanmar people they live in a quite a clean life. Whatever they have, the resources, whatever the water they have, they try to maintain. If you go to the even difficult places in Irrawaddy or go to the mountain areas, you will see the houses and the life they are living. They might be poor, but they try to maintain a kind of decent and clean life. But also I have noticed that many places I visited Kaya, and I have seen the children, they're playing around. And I heard that from their parents that they haven't taken shower for a few days, and their dress are not very clean. And I asked why. Is it the culture practices? They said no. We don't have water, and we often call our water is a coffee. Basically, it's a mud come with the water because of the lot of deforestation on the upper part. So that's why their water is not clean, and very little water they get it. It's not everywhere, but a lot of places like that. So though culturally Myanmar people, most of the state and regions, they want to be maintain that hygienic life, like take shower regular basis, wash hand regular basis. But the issue is often they don't get clean water to take shower or wash hands. So that challenges are there. But in general, I will say that Myanmar people they maintain quite good quality hygiene.
ဒီဆရာပြောခဲ့တဲ့အထဲမှာဆိုရင်ဒီ water sanitation hygiene ဒီ sanitation နဲ့ hygiene ကတော့ကိုယ့်ရဲ့အလေးထားပေါ်မူတည်ပြီးတော့ဒါပြောင်းလဲနိုင်တဲ့ goal တစ်ခုပေါ့နော်ဒါပေမဲ့ water ကတော့ဒီရေကတော့လိုအပ်ချက်တွေမြန်မာနိုင်ငံမှာအခုရှိနေပေါ့ရေနဲ့ပတ်သက်တဲ့ဟာမျိုးပြီးရင်အခုဆိုရင်ဒီ water nation law ဒီဥပဒေကလည်းတိတိကျကျမပြဋ္ဌာန်းနိုင်သေးဘူးပြီးတော့မြေအောက်ရေစီမံခန့်ခွဲမှုဥပဒေမျိုးဆိုတာလည်းတိတိကျကျမထွက်လာသေးဘူးဆယ်စုနှစ်ကြာနေပြီပေါ့နော်အဲ့တော့ဒါနဲ့ပတ်သက်ပြီးတော့ဆရာဘယ်လိုသုံးသပ်မိလဲရေရင်းမြစ်သုံးဆွဲမှုရေရရှိမှုအနေအထားတွေပေါ့ဒါလေးကိုရှင်းပြပေးပါအောင်ရှင်
Yeah, you pointed out rightly about these challenges that yes, people want to maintain good quality hygienic lifestyle, but the problem is that they may not have access to adequate water and also the sanitation facilities at home and also in public places. Government, they develop a lot of strategies and policies, investment plan, but within few years it's difficult for a government to implement everything together. So for the time being, what we also trying to advocate with the government is prioritization, that where they should invest more and quickly, like ensure access to water first is very important. Access to drinking water as well as the potable water, so that they can get a water for household use, and this is the first priority. And at the same time, that ensure that no one in communities they go for open defecation. So ensuring open defecation free area is very important, and for that government currently they are working on a national sanitation policy, and if this policy government approve, and then probably it will help government to invest for ensuring that all people in Myanmar they will have a decent toilet and also with the water supply, so that they can maintain good sanitation and hygiene practices. So if they they use this their a kind of strategy of prioritization, and hope that within few years and within this 2030 everyone will have at least the basic level of water, access to water and sanitation.
ဒီ WaterAid မြန်မာအဖွဲ့အစည်းအနေနဲ့ပေါ့ရှေ့ဆက်ပြီးတော့ဘာတွေလှုပ်ဆောင်မလဲအနာဂတ် plan ပေါ့နော်ဘယ်လိုတွေရှိလဲဆိုတာလည်းသိချင်ပါတယ်ရှင်
WaterAid Myanmar, what we try to work on is the two aspects. One is working with the communities, building the community capacity and their changing their attitude and behavior towards hygiene practices, and also use the proper sanitation, the toilets. That is the one area. But at the same time, we're also working with the government for system development or system strengthening, so that government have the proper system to monitor where, identify and monitor where they have a biggest need, which area, how they are implementing those. So monitoring government own performance and own work, as well as the need where they have to invest for water and sanitation. This is the one area that we work. We're also working with the government and also the other UN system like UNICEF and WHO to ensure that the government they have a system of monitoring the water quality or the behavior change of the people, as well as they will be able to monitor that how much that investment they're doing, which area they're doing the investment, and also that how the government system, that bureaucracy will function well to ensure that each and every corner of the country they will be able to ensure that educate water and sanitation and hygiene behavior changes. We also work with education system and health system, so that health care facilities, we call the hospitals in rural areas and urban areas, they have enough clean water, and also we call the system to ensure the better infection prevention and control of diseases, so that the proper maintenance of the hygiene practices there, it is important that people do not spread the disease further from the hospital. So these are the area that we are working more, the community, with the government, with the schools and hospitals.
နောက်ဆုံးအနေနဲ့ပေါ့ဒီ WaterAid မြန်မာအဖွဲ့အစည်းနဲ့ပတ်သက်ပြီးတော့ဆရာဖြည့်ဆွဲပြီးပြောချင်တာရှင်ပြောပြပါအောင်ရှင်
In terms of our future plan, we want to continue working with the government for the system strengthening. As I said, that this is very important, that because wash is a responsibility of the government to ensure water, proper and adequate water and equitable and accessible water for everyone. And also it's a government responsibility to ensure that all people in Myanmar, they use the educate, and also they use the proper toilet, so that no one get the disease because of the spread through the flies. So this is the area that we are working on, and also we'll continue, but we will improve our work more with the school and hospitals. Why school? Because we want to address the children issues. If we invest on the knowledge from the children in their early stage of their life, this knowledge they will be able to take it forward for long term. It's like if they live for 70-80 years, this knowledge will remain, and also the children will be able to take this knowledge to their family level. They will share with their parents and their neighbors, their siblings. So that's why we want to invest more on children through the school program.
အခုလိုမျိုးချိန်ပေးပြီးဖြစ်ကြပြီးရတဲ့ Mr. Shihab ကိုအရင်ပဲကျေးဇူးတင်ပါတယ်ရှင်
Thank you very much to Channel K.